What's the typical social downtime following a facelift? Hi, I'm Dr. Delaney, a board-certified facial plastic surgeon in Houston, Texas, and let me go over what we typically tell our patients. To make things simple, we usually tell our patients to think about the recovery in different stages. So the first 2 weeks is what I call the acute stage. So during this early period, we encourage our patients to rest at home. A lot of times their friends and families may be really excited to see what their results are like and want to come over and visit. And during this time, it's important to tell them, hey, I'm recovering, give me some space, I'll be able to see you, in a few days. During this period, our patients could be swollen, potentially bruised, so it's really important to try not to take on too much, whether it's physically or socially, and really just focus on healing and taking care of yourself. Around 2 weeks after surgery, most of the potential bruising and swelling has resolved, the incisions start to look better, and then at this point, most patients feel comfortable going out, running errands, going to get some groceries, or even having friends over. In fact, some of our patients even feel comfortable going back to work after 2 weeks. But this is only if you're okay with people knowing you had something done, or you're willing to put in a little bit of work to kind of camouflage some of the incisions, or if you have hair, you could cover over your incisions. For those who would rather keep their surgery more private, I then recommend waiting about 4 to 5 weeks before you make your social debut, because at this point the healing will continue to have progressed, and so most people who see you will notice that you look refreshed, but won't wonder what exactly has changed or whether you had surgery or not. And then lastly, for major life events, whether it's a wedding, graduation, or being on camera if you're filming, we recommend waiting about 3 months. So you're going to look great well before then, but that additional time allows everything to settle, that last little bit of swelling to settle, and this way you're going to look your absolute best for your important life event. And remember, everyone heals differently. So these timelines, these 2 weeks, 4 to 5 weeks, 3-month recommendations are just general guidelines based off of what we see people typically heal. But everyone could be different. Now, if you know you are a slow healer, a lot of times people do know that, budget an extra 1 or 2 more weeks for your timeline. So if you have an upcoming event you want to look absolutely great for, give yourself more time. A lot of times we have patients who come in who want to look good for a wedding in a month. Well, that's simply not enough time to have your surgery recover and look your absolute best. So plan accordingly, and this way you'll have your best look for your big event.